So get ready with your notes. Chagas disease. Yeah. Yes. So Yes. So we have done this already. Okay. Yeah. Yes. Yeah. Okay. No problem. Just we'll rush it off fast and we move to the next. We are not doing the test. We are just analyzing the test so that we can do all the different types of questions. Right. Now let us see in this question. Okay. In this question, there are some important words. I want you to identify those words here. I want you to identify those words here. 10 minutes, we are just identifying the words. Yeah. Okay. Neglected. This is the most important word. Neglected. Okay. So why is it neglected? Right. So because of the social groups, it mainly affects. It is groups. Groups. And along with that, social groups. Along with that, social groups. Next, because patients often don't realize their so problem is with the patients. Problem is with the patients because its impact is severe in a relative small number of cases. Because its impact is severe in a relatively small number of cases. So here cases. Here the groups, the communities, the groups. Okay, and here the patients, one person. Here cases. Here the entire group is the problem. Here the individual is the problem. Here the individual is the problem. And here, now try to how this is differentiated. Try how this is differentiated. Here groups, because of the social groups, it may affect. So groups may include patients, may include all the patients who are infected with the disease, and the people who are not infected. This is positive and negative people. That means infected and non-infected people together. This is 100%. And this is one person, patients, individual patients. And this is the cases, the statistics. So multiple patients. We can see here. Here he's talking about the individual patients. Here talking about the cases altogether, and here is talking about the cases plus non-cases. I think you should understand the difference here. That is very, very important. You should understand the difference, which is very, very important. Yeah. So now how to identify? I'm not giving you the listening test here. I'm not giving you the listening test here. I'm giving you something else. I'm giving you something else. Without giving the audio, I'm going to show you this. Okay. What you are expecting from the audio. Okay. That is the most important thing which I'm going to show you now. Yeah. Now, neglected. What do you mean by the word neglected? Come on, give the synonyms of the word neglected. Yeah. Write down the synonym of the neglected. Neglected means there are many synonyms. There are many synonyms for the word neglected. So now let us see how we are going to use this word. Yeah. Sidelined, marginalized, neglected, rejected, given less importance, okay, unimportant. So that's it. Now, let me show you here the text. I'm going to show you something very important now. So this is called audio script. When you are listening to the audio script, what are the clues that you have to look for is important. Okay. Now let us study these 4 words. So everything is focused on these things. Neglected. Why it is neglected? Because of the social groups. Why means because. Why means because. Everyone knows that. Why means because. Okay. Okay. So question number 31. Yeah. Why is it neglected? Now we are going to see that. So here it is. Now if you see very clearly here. So till here enough for us. Yeah. Now if you see very clearly, let us study this one. Okay. Why today we are talking to Dr. Jack Robson, a cardiologist and Chagas disease specialist in the USA. What is Chagas disease and why it is referred to? Why? Why means because. Why means because. This is the most important word. Why means he's asking for the reason. Reason means because. It means Chagas. Referred to as neglected disease. Neglected. Why it is told as considered as referred, considered, pointed, okay, showcased as neglected disease. Yeah, now let us see here. Here, this word neglected is the most important word. Now, what is the synonym? What are the synonyms? You have to be ready with the synonym. Then only you will get this idea. Okay, neglected. Neglected. I'll show you the words here. Now, here, indifference. This is the word, indifference. Questions will be like this only. So, you have to be little careful. Questions will be like this only. So, you have to be very careful. Okay. Right. Now, indifference. You have to remember those words. Okay. Okay. Now, indifference. And another word is marginalized. These are the two words which means neglected. Okay. So here you can understand neglected. These are the words which are very, very important. This indifference, it means it is neglected. It is neglected. About 7 million people worldwide are thought to have Chagas, but it attracts relatively little publicity or funding for research. That is means it is, but about 7 million people worldwide are thought to have Chagas, but it is neglected. Try to understand, so much important thing, but it is neglected because it attracts relatively little publicity, means not attracted by the public, not given public importance. Public is not giving importance to it, means it is neglected. Little publicity means little publicity, not too. Why not too much publicity? Too much publicity means not neglected, but less publicity means neglected. Try to understand. So this indifference, what indifference? Little publicity and little research. Okay, little publicity, little funding, little research, little, very little, because it is neglected. If it is not neglected, it is too much publicity, too much funding, too much research will be there. So try to understand how it is talked here. Okay, this indifference is largely down to it being primarily means mainly a disease of marginalized communities in Latin America. So that means you should understand here communities and marginalized in Latin America. Okay, it down to being primarily a disease of marginalized communities in Latin America. Now you see here very clearly marginalized communities in Latin America. Now this is the way how you have to identify. Neglected means indifference, neglected means marginalized, and this is related to the most important word alongside is, yeah, the most important word alongside is communities and Latin America. Communities in Latin America, is it a group or is it an individual or is it a case? Come on, answer. We have three different things. You remember that one. Is it groups or is it patients or is it cases? Come on, give the answer. Yeah, I hope you understand Rani now. I'm not teaching the test. I'm teaching you the techniques. So I'm teaching you the techniques, how to identify the words. How to identify the words. Neglected means marginalized and indifference. Both are synonymous. There is indifference, but it is neglected because they are marginalized. All are same. What? Is it group? Yeah, communities means groups. Communities not means patients. Communities doesn't mean cases. Okay? Communities doesn't mean patients. Communities doesn't mean cases. It is mainly because of the marginalized communities, means groups. Now, if you see very carefully here, because of the social groups. Society means community, groups means groups, communities. Okay? Society means which society? Latin American society. Communities means groups, Latin American society. So social groups, social means society and groups means communities. So this is how you are going to identify these particular things. So if you can realize these things, So if you know that they are playing with the synonyms, now I'll tell you these three words. The most important words are, yeah, okay. Master, mastering vocabulary, mastering vocabulary. Now there are three important words here. The words here which are playing the maximum, one is neglected, one is indifference, one is marginalized. Why these words are very important for us? So don't try to think about the answers here. That is not very important. The most important one is, yeah. So go to Cambridge Dictionary. I'll show you what type of words these are. Neglected. What do you mean by the word neglected? Neglected, okay, neglected is an adjective. Neglect is C1 vocabulary. Neglect is C1 vocabulary, and neglected is even more than that. Okay. Now let us see the meanings of these words. Not receiving enough care or attention. Not receiving smart vocabulary. Yeah. So here you can see, yeah. So lot of words you will get here. Neglected. Okay. Push someone aside. Put something out of your mind. Set something aside. Okay. Lot of words you will get. Unaddressed. Okay. Unaddressed. Unrecognized. These are all. Many other words are there. Untended. Unheeded. Giving a deaf ear. Okay. Wink at something. Undeserved people, undermined people, marginalized, neglected, all this. Okay, shut your eyes to something, idiom. All this related to neglected, marginalized. So it is a C1 vocabulary. Neglect. Neglect is C1. Okay. Neglect is C1. Yeah. So that is neglected. This is C1. Now let us go to another word, that is marginalized. Marginalize. Okay, margin, marginal. Marginal is C2. Very small in amount of. Okay. So it's very, very important word. Marginalize is even powerful than this. Okay. Marginal means given very small attention. Very small attention. Learn these words. It will be easy for you to understand the text. Next one is uh, indifference means a C2 vocabulary. C2 vocabulary means very powerful word. You will get 450 plus marks. Okay. So these are the three words which are very, very important. And society means what? Next one is society, community, community. Community means, okay, synonyms. Community, public, okay, colony, okay, culture. Lot of words are there, okay, in which a society means group, a peer group, okay, community, society, right? Society, okay. So now let us take society. Society means what? People, okay. Society means people. A part of the society comes people. Society. Now smart vocabulary. Society. Okay. Society means civilization. Society means culture. Society means group. Okay. Society. People. Group. Culture. All these things related. Synonymous. Okay. Yeah. Now let us see how important it is. Now your OET is based on this one. Remember that. Now we'll go to the next question. Here is the next question. Okay, why means because. Why means because. Reason and result. Here also result of. Result of means cause and effect. Why means because, cause and effect. So questions will be based. Okay. Now let us see here. Here is another question. Okay. Here is another question. Now let us see. So I've already explained you these questions. You can go through these questions. Okay. You can go through these questions. Concerns. Concerns. Yeah. Dr. Robson says that concerns over Chagas in the USA are the result of a rise in the number of people at risk of being infected with the disease, a greater awareness of how many people there have the disease, an increased prevalence of the insect which carries the disease. Now, if you see here very carefully, yeah, yes, I'm just showing you the points. I'm not giving you a test here. I'm just showing you the points. That's all. Yeah. Now you can see here. Dr. Roberts says that concerns over Chagas in the USA are the result of. Okay. Now, what are the important words here? Concerns. Concerns means worries, tensions, problems, difficulties, and all. Result of or the result of means result means consequence means effect. That means cause and effect. Like previously, why means because. Because means cause and effect. So Study this word. Result means cause and effect. So what is the reason? Okay, concerns means people are worried. Why are people worried? Again, why based question means because. So because of what? Because of what? Now you see there, because of what means you can understand very clearly here. What is the reason? That's the question. What is the reason of these concerns over Chagas in the USA? What is the reason for these concerns? Okay, concerns are the result of. Concerns are there because of something. What is that? Because of what? A rise in the number of people at risk of being infected with the disease. A rise in the number of people. A rise in the number of people. So number is problem here. People at risk. If it is not rising, there is no risk. There is no worry. So number is the problem here. When statistics is the problem. A greater awareness of how many people there have the disease. Awareness is the problem. Awareness is the problem. Awareness is the problem. Awareness is the problem. Next one, an increased prevalence of the insect. So insect is the problem. So number is the problem, awareness is the problem, and insect is the problem. Now let us study this one very carefully. Okay, because of what? Result of what? Result of the statistics. Statistics are increasing. Okay, earlier there were less number of cases and now the cases are more. Earlier there was no awareness, now there is awareness. Okay, earlier insect was less prevalent and now insect is more prevalent, more common. So now which is the problem? Statistics are the problem or people's awareness is the problem? Because of awareness there is concerns. If people are not aware, people will not be concerned. Insect is there, so they are concerned. The number of cases is increasing, so they are concerned. So what? Statistics is the problem. Knowledge of the people is the problem. Awareness, and insect is the problem. Presence of the insect is the problem. Now, why? Why are people concerned? Why are the people concerned? Yeah, now let us see here. So this is question number, yeah, Thunderbolt 2. Second question. So we are going to see, Dr. Rani has asked me to take B today. So I'm going to take as many B's as possible. Okay, right. I'm not here giving you a test. A test you can do. I'm teaching you techniques how to find them out. Okay, what are the words? Concerns are the results of what? Worry is because of. What are the reasons for the worry? Why are they worried? Why are they concerned? Why? Same question like that one, but in a different, wolf in a sheepskin, or yesterday you are in different clothing and today you are in different clothing. That's all. Dress changed. In the office you are like one person, and in the at home you are like different. You will not be like how you are in the office at home, and you will not be at home how you are in the office. So different dresses. Okay, dress code we call it. In the same way here, the code is changing. Dress code is changing. Monday you wear blue dress, Tuesday you wear yellow dress, something like that. Okay, so shape is changing, form. Okay, the appearance is changing, but the question is the same. The basic question is the reason, cause and effect. Cause and effect theory, write down. Cause and effect theory. Remember that. You have nothing to do here. You have only thing to learn. That's all. Okay. How vocabulary is playing the role here. So question 32. Question number 32. Yeah. Now let us go to the point here. Yeah. Now here, Now, second question is here and here. Yeah. Partly here and partly here. Yeah. So here partly and here partly. Okay. Yeah. So let us see this part. This part. Okay. All right. What I have to do is I should do something for you. Okay. 1 minute. So next one part is here. Yeah, this one. I'm trying to bring both of them together for you. Yeah. Yeah. Now you can see this. You can see this. So that is a continuation in the next page. Now you can see, why are they concerned? Are there concerns in the USA about Chagas? Yeah, go through this point. Are there concerns in the USA about Chagas? How do you understand that the topic is changing? How do you understand the topic is changing? Now let us see. So, if you see, I'll tell you how it is changing the topic. Here is talking about neglected disease. Neglected disease. And here is coming to USA Chagas. USA. The topic is about, this topic is about Chagas, why it is neglected. And this topic is about the USA. So USA is coming into the picture. So that means question is changed because you will not know. And here the interviewer, Dr. Jack Robson. Dr. Jack Robson, if he's a male person, interview will be a female person. So it is little easy for here. But if it is a monologue, it will be little difficult. Monologue means one person speaks, it is difficult to identify when the question is jumping into the next one. Okay. Now here, USA has come here. And in the next one, and for benefit of our listeners, can you describe an individual case? Individual case is the different here. And individual case is Marisol here. He's talking about Marisol. So this is about Marisol. Okay. So this is how you identify the questions there. Okay. Now let us see our topic here. Here is the topic. Now just identify this one. Right. Concern, concern. What is the word which means concern here? Yeah. Yes. Anju Kumari, good. The word is alarming. The word is alarming. Yeah. The word is alarming. So, the insect carrying the parasite is actually endemic to the southern US states. Since 1955, however, no more than 30 people have been bitten and infected while in the USA. The alarming thing, though, is that it's become apparent, very clear, that large numbers of first generation and some second generation immigrants from Latin America carry Chagas. Okay. The alarming thing that is, though, is that it is becoming apparent that large numbers of first generation and some second generation immigrants from Latin America carry Chagas. Around 300,000 numbers. These people won't infect others apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill. Now, based on this, you should understand concern means alarm. Concern means alarm. Okay. Concern means alarming. So this is how you can identify. Now we have made this listening into reading now. Can you give your answers, please? What do you think is the answer? Let us check before moving further. Give your answer, please. Yes. You can give your answer. What do you think answer according to this? I have converted the listening into reading. What do you think is the answer? Now let me give you the question once again. Yeah, here it is. A rise in the number of people at risk of being infected with the disease, a greater awareness of how many people there have the disease, an increased prevalence of the insect which carries the disease. Yeah, I can give you to check. Write down your answer. Yeah, so here it is. This is question number 31. Okay, you can watch this video. I've explained two questions there for you. So this is the way how you have to analyze. This is the way how you have to analyze. Okay, all right. And yes, this is the previous explanation I have given, how you have to analyze. Okay, right. Then this is the next question, which we have done just now. Okay, this is the question which we have done just now. So, result, concerns result, a rise in the number, greater awareness, increased insect, okay, prevalence of insect. So, rise, greater, increased, all are same. This is number, this is awareness, and this is risk, insight. Okay. So you can see here how they are eliminated. So just now I have shown you. So this is the elimination criteria. This is the elimination criteria. Okay. The people have given the answers. Let me check. Most of you have given. Yeah. So B, B, A, A. Okay, now let us check the answer. So now I'm taking it to the answer key. So today there are a lot of sessions. Okay. So okay. Now we are going to part C. Yeah, first one is A. First one is A. What is A? Because of the social groups it mainly affects. 31 is A. Now 32, let us check your answer whether it is correct or not. 32 is B. 32 is B. Yeah. So you have seen the answer here. A greater awareness of how many people, the number of people there have the disease. Okay. They know how many people is not just increasing number. Yeah. You can see there. It's become apparent, means very clear. That means everyone knows. Apparent means clear. The alarming thing though is that it's become apparent. Apparent means very clear. The word is very important. Okay. I'll take you again to the dictionary. Apparent. I told you words are very, very important. It is B2. It is B2. Able to be seen or understood. By whom? By the people. Apparent means very clear, very clearly understood. Okay. Her unhappiness was apparent to, that means apparent means appear to everyone. Increasingly, that means people can see it is okay, seen or noticed by everyone. That is apparent. Okay, C1, seeming to exist or be true. It is C1 vocabulary. C1 vocabulary, you can see this is C1 vocabulary. It is C1, it's not an ordinary word. It's seeming to exist or to be true. Yeah, it is existing and it is true in the society. That's what he's telling here. So, C1 vocabulary, apparent. Learn the meaning. Apparent means visible, clear, noticeable. So, this is the word which is very important. That means everyone can see it very clearly, notice it very clearly. Okay. Apparent means a distinct. Another word for apparent is distinct. Yeah. Distinct. Distinct. clearly noticeable, that certainly exists. Same meaning you can see here. Write down the synonyms. This word will come again. Is apparent will not come. Distinct will come. Then what you will do? Then what are you going to do if you don't understand this word? Okay. Learn the meaning of this word. Distinct, apparent, clearly noticeable, that certainly exists. So noticeable. Noticeable. See one vocabulary. Easy to see or recognize. This is also another word. These are synonyms. Learn the synonyms. Nah? Learn the synonyms. See, 3 words I gave. Apparent, distinct, noticeable. So if you know these words, it will be very easy for you. Otherwise, it will be little tougher. Okay. Now, let us see here. Apparent. That large numbers of first generation and some second generation immigrants from Latin America carry Chagas. That's it. They carry Chagas. That means they have. It's not increasing. They already have. They already have. Existing. They carry Chagas means it is existing. It is endemic. It is within the society. Okay. Try to understand that one. Apparent means very clearly observed that there are large number of people already affected. It's not increasing. It is not increasing. But they already have. Since 1955, however, no more than 30 people have been bitten and infected while in the USA. While in the USA, they are not bitten, they are not infected. Since 1955, no more than 30 people. The parasite is there, endemic, inside the body already. Try to understand here. So, it's not increasing, it's already there. So, no more than 30 people. Just 30 people means what is increased there? Okay, it's not increasing. That is not a great increase. But it is apparent that large numbers of first generation and some second generation immigrants from Latin America, those who came from Latin America, already have this disease. They already have this disease. They already migrated to USA. In USA, people are not getting this disease, but they already they came and they are settled here. They already have this disease. The immigrants from Latin America, they already carry this disease, and this parasite is endemic. Endemic means what? What do you mean by the word endemic? Should know that one, the word meaning there. Endemic means especially of a disease or a condition regularly found and very common among the particular group or in a particular area. Endemic, it is already existing. It is already existing. It's a common thing there. Endemic means perfectly all over the society. It is there already. It's not coming now. It's not increasing, but it's already there in the people. Okay. So you can see here, apparent means very clear, existing, true. Okay. It is true that large numbers of first generation. So first generation and second generation, they already have Chagas. So where is the question of increasing? Okay. Right. Be careful. They are already carriers of insect, parasite, already there in the body. So then this is increasing because they won't infect others. They won't infect others apart from congenitally and possibly through blood transfusion only this passes. That's it. Okay. So that's very clear and it shows you here. Right. People, how many people there? Yeah, 300,000 already have Chagas. So how many people? 300 people, more than 300,000 people. And they already know. They already know. How do they know? Because it is apparent. It is apparent, means knowledge is known. Apparent. Okay? Knowledge is Apparent means clearly known, understood by everyone. Everyone has the knowledge. That means awareness. Apparent means awareness. It is very clear. That means you are crying. That means it's clear that you are in sadness or sorrow. It is apparent. That means I have the awareness about your difficulty. I am aware of your problem. That's it. Okay. So try to understand the synonyms, how they play. Right. So I've explained 2 points from this one. Now, next. Yeah. Dr. Rani, unmute. Are you there? Yeah, Dr. Rani, if you have any questions which are confusing, problematic, okay, this we have already done. I have given you some examples. Do you have any 1 or 2 questions or any particular part C which you want me to explain? Yeah, if you have anything, I cannot hear anything from you. So if you have anything, you can tell me, which you can send me on WhatsApp, the passage, so that I can explain you. Swati Nemade, Dr. Swati Nemade, Dr. Swati Nemade, unmute, please.
Hello,
Yeah, yeah, yes,
sir.
Rani, tell me. I'm sorry, I cannot hear
Sir,
anything
your
from you.
voice break. Can you repeat, sir? What is?
I'm telling you, do you
Hello.
have any passage, extract, part C, which you want me to explain? Tell me. You can send that one and I'll explain. Okay.
Oh,
Dr. Swati, do you have anything for me? You have any
Yes,
difficult one,
yes,
you
sir.
send me, I will explain that for you. Swati.
Okay, sir.
Yeah, yeah. So now we'll move on to the third question. We are moving to the third question. Yeah. These are called the markers. First one is the concerns. Second one is USA. Third one is Marisol. Individual patient means Marisol. So we have here the third question. Yeah. This is the third question. Go through this question. Third question. Yeah. Question 33. 33. Yeah. 33. Yes, Swati, I got your question. I will do that. You can send me the PDF and tell me which page, which question. Then it is easy for me. If you send like this, I cannot show it on the computer. Na? You can just send the PDF, original PDF, and tell me which page, which question. Then I will explain. All of you, you can send it. Yeah. A patient called Marisol recently asked Dr. Robson to test her for Chagas because came. See, everything is cause and reason, question. Because of what? Because of what? Now you should focus on these things which are very important. So all of you take a minute and invite your friends if you can. We are going to make a big session out of this. We'll attack this part C and we'll see the depth of this part C. So what I want you to do is you can invite your friends. We'll do as many sessions as possible, as many questions as possible. Yeah, thank you, Dr. Rani. You have invited Dr. Sadaf. Thank you. So invite your friends. Okay, invite your friends, send them in your groups, invite your friends and see whatever you can do so that they can come and join our session. We are going to learn a lot of things today. Yeah, please. We are going to do a lot of things now. I'm going to show you the secrets, more secrets. See, first question was, you remember, I'll show you. First question was, we understand the monotonous style of the questioning pattern. Now let us see here. First question, why? Why means what is the reason? Reason means cause. Cause means cause and effect. So cause and effect type of question. This is number one. Number two. Result of reason and result means effect, cause and effect, again cause and effect. Second question is cause and effect again. Third one, because means what? Cause means cause and effect. So all the three questions we are going through now are cause and effect based questions. So you should understand. If you understand this, it will be very easy for you. Yeah. So because last week we have our students went for the exam. There were 6 students who went for the exam. So 6 places have become empty. So I'm giving a demo session. If anybody is interested, you can contact me on my number and I'm going to give admissions, doctors and nurses. Okay. Now let us see here. What do you think from this part is the most important word? Because a patient called Marisol recently asked Dr. Robson to test. Test because of what? What is the reason for the test? Because means cause. What is the cause? Because means what is the cause? Because means what is the cause? Right. So you can understand here very carefully. Yeah. Now because test because of. Why did she ask for test? Why did Marisol ask for test? Because she was worried about the health of any children she might give birth to. Children, her family. Okay. She wanted to know whether it was safe her to donate blood, donate blood, donate blood. Okay, this is others. She thought she had symptoms. She had symptoms associated with the disease. She thought she means herself. So is she bothered about herself? Or is she bothered about her children? Or is she bothered about the others? Because she's giving donation of blood. There is the clue. She's asking her to test. Why? Is it because of herself? Or is it because of her children? Is she worried about herself? Is she worried about children? Or is she worried about the people whom she is going to give donation of blood for? Worried about whom? Because of the worry. Worry for whom? Worry for whom? Is it herself? Or is it her family, her children? Or is it others because she is going to outside family? Individual, family, and others. So why is she asking that? See how you have to identify. How many of you appreciate this question, this explanation? Appreciate this question. How many of you appreciate this question? Do you appreciate this question? Explanation. So the question is very wonderful here. If you appreciate this question, you would say, yeah, give me your point. This explanation result 0 to 10. Give your score. If it is excellent explanation, you give 10. If it is nonsense and waste of time, give 0. Yeah, fast. I want to know whether you understand the depth. I don't mind whether you give 0 or 10. I don't mind. But the thing is, I want to know whether you are able to understand what I am telling you. Why this is important. If you said 10 out of 10, that means this explanation is very important so that it will be helping you much. So that is what I want to understand. If it is, if you are giving 0, that means this explanation is useless. So I will try to find out some other explanation to help you. Na? So that is why I'm asking you, don't be silent. When I ask you explanation, just give something. I am not going to benefit much with your points, but you will be benefited because I'll find out some other way to make you understand this one. That is what the point is. If you understood, I don't need another explanation. If you did not understand, then I have to do something else. Yeah, right. Now, is she worried about children or is she worried about others or is she worried about herself? That is the point here. Okay. The reason for testing is children. She is going to give birth to children. That's why she wants to, whether the children will get this disease. She is going to give donation blood to others. So that is why she is worried whether others also will get this disease. So she is thinking maybe she has some other associated symptoms, some other related problems. So she wanted to get a test. That's it. Yeah. So there is the point there. Now let us go to the analysis. Yeah. Now let us see here. We want a little bigger size, right? Yeah, here it is. Sorry. Yeah. Now let us see here. This is the central part. Focus on this area. Focus only on this area. Focus on this area only. No need a distraction. Other areas, no need. Okay. Yeah. Now let us focus on this area. Yes. Yeah. So, word after word we'll learn. No problem, Dr. Sadaf. Word after word we'll learn. Now, if you see very carefully, and for the benefit of our listeners, can you describe an individual case? Okay. Can you describe an individual case? Well, this year a Bolivian woman, let's call her Marisol. Okay. So the word Marisol came here. Asked me if she could be tested, for Chagas. She is a long-term US resident, but she had recently been on vacation in Bolivia and at one point had felt unwell. This often occurs with changes in diet and living conditions. And that's what Marisol assumed was the cause. What was the cause? See here. What was the cause? Marisol assumed that this is the cause. Okay, assumed, not reality. Assumed. But what was the? She had actually, this is the origin. She has actually been planning to donate blood in Bolivia. She's actually planning to donate blood in Bolivia, but changed her mind at the last minute. Ironically, if she had gone ahead, the screening would have detected Chagas. Hearing from relatives that Chagas can be transmitted congenitally was what prompted Marisol to come to my clinic. Congenitally transmitted. Chagas can be congenitally transmitted. That was what prompted, that was the reason. Transmitted congenitally, congenetically. And that was what prompted Marisol. That was what compelled Marisol. That was what motivated her. That was what persuaded her. That was what encouraged her. That was what made her, okay, to come to my clinic. She and her partner wanted to start a family. She and her partner wanted to start her family. Okay. So this is the reality. Okay. This is the reality. Try to understand this. Okay. Right. Now here, Marisol came to my clinic. She and her partner wanted to start a family. I told you, children means family. And she was scared that she might pass the parasite on to her family members, children. Try to understand this. The test then showed she did indeed have intermediate stage Chagas that we don't need. She was scared that she might pass the parasite on to her children. Try to understand the point here very clearly. There is nothing to be worried. Yeah, Dr. Sadaf, I think you are very clear. So, children means family. Children means family. So, safe. So, she might give birth to children. She might give birth to. So, you can understand from here very clearly. Okay, it's very clear. There is no problem if you can understand the words. So, here, donate blood. She's going to donate blood. No, she wanted to donate blood, but she changed her mind. She changed her. She actually been planning to donate blood in India, but she changed her mind in the last minute. So that was not the problem. She's not going to donate blood. You can see here, this is ruled out. She wanted to know whether it was safe for her to donate blood. No. She wanted to donate, but she changed her mind so that she does not want to donate now. Earlier, when she was in Bolivia, she wanted to donate blood. But now she doesn't want, she already changed her mind. That's gone forever. It is ruled out. It is ruled out. Next. She's actually been planning to donate blood in Bolivia. Actually, she was planning, but changed her mind at the last minute. Yeah, ironically, if she had gone blood, the screening would have detected Chagas. Okay. Then next one. If she had really given blood donation, they will first test her. Then they would have detected that she had Chagas and they will not donate the blood. So she would have at least have got the detection. She would have confirmed that one that, but she did not. So the disease is not detected. So now she wants to get detected. Why? Because she wants to start a family. She and her partner. And she's afraid that this disease, this parasite is, so it is already, they are carrying already, she is already carrying the parasite. And if she is already carrying the parasite, this parasite may be passed on to the next generation. So that is why she wants to, yes, go for the test. She wants to go for the test. The point is very clear here. Chagas can be transmitted congenitally. This is what is the reason. Prompt. Prompt means reason. Prompting. Okay. Why did you go to why did you take leave? My mother prompted me to take leave. Why? Because there is home, the work at home. There is work at home. What prompted her to take leave? Some work at home prompted her to take leave. Motivated her, encouraged her, asked her, suggested her, guided her. All these are synonyms. So wanted to start a family. The word is family here. They are starting a family. And she was scared that it might pass she might pass the parasite on. So that is why the test, she's going for test because they are going to start the family. They are going to start the family. Okay. Family. They are starting a family. Okay. Just because they are going to start a family. So simple as that. So I hope the explanation is clear with you. Okay. Satisfaction level. There is nothing to think about. Satisfaction level. Yeah. So, what is your satisfaction? How are these synonyms helping? The secret is synonyms. The ultimate secret is the synonymous language. And you can count it as a one word, that is vocabulary. If you know the vocabulary, you'll master it. Yeah. So 3 questions done. Are you ready for some more time? Are you ready for more? Ye dil mange more. Boost is the secret of my energy. Do you want this boost? What is the boost? Boost is synonyms. I'm teaching you synonyms. I'm not teaching you. I'm not testing you. Yeah. Only one person is ready. That is Dr. Rani. What about the others? You're not interested? Okay, I'll keep only Rani and send off everyone to sleep then. Nobody wants. Okay, Vijay also is ready. Fine. Yeah. This is the explanation. Right. Family means children. She's going to give birth. She's starting family means she's going to give birth to children. So easy, so simple. The secret for success. is to equip yourself with vast fund of synonymous vocabulary. Yeah, that is the secret. That is the secret. Okay, half of them are there. Yeah. So we are going for some more questions. Some more questions. Then after this finishes, we will do part B. How many of you are ready for part B? Next one, we want reading or listening. 1 minute. Now part C. Now part C going on. Now part C going on. Okay. After part C, do you want me to shift to reading or listening? What do you want next step? Reading or listening? Do you want me to shift to listening or continue listening? Shift to reading or continue listening? Let me plan for myself for the next session afternoon. Do you want me to take reading or listening? Come on. Give your voting. Reading part C. Okay. Reading. Yeah. Come on, give your voting, please. Yeah. So majority are saying reading. Okay. Reading part B or part C? Part A or B or C? A, B or C? Yes. Come on. So reading part C. Yeah, we'll take part C reading. No problem. Now let us continue with the remaining texts. Yeah. Yeah, 34. Now next one, we are moving to Jennifer. Is it 4? Thunderbolt 4. Yeah. Yes. Yeah, party also will see. Party also will see. Okay, one by one we are dealing, no problem. Okay. Yeah, this is the question. Yeah, this is the question. Go through the question, please. Yeah. What problem does Dr. Robson identify in the case of a patient called Jennifer? What problem does Dr. Robson identify in the case of a problem? What problem? Okay. Try to identify the question here. Yeah. So here you have to identify why it is, how, in what way they are separated. In what way they are separated. What problem does the Dr. Robson identify in the case of a patient called Marisol? Yeah. Now let us study this question. Yeah. What problem? What is the problem that Dr. Robson identified in the case of patient called Jennifer? What is Jennifer's problem? So Jennifer's problem. What is Jennifer's problem? An unwillingness to accept that she was ill. So problem is with her. Problem is with her. She is not ready to accept. The problem is with her. She is not accepting. She is not willing to accept. She is not willing to accept. The problem is with Jennifer. Jennifer is the problem here. An inability to tolerate the prescribed medication. The medicine is the problem. The medicine is the problem. She cannot tolerate this problem because medicine is very powerful. So she herself, mentally, she is not, mentally she is not strong. She is not ready to accept. She's adamant. She's reluctant to accept that. Okay, she was ill. So problem is with Jennifer. An inability to tolerate the prescribed medicine. Medicine is the problem here because this medicine is very powerful. The body, okay, of Jennifer cannot accept this medicine because she cannot tolerate this medicine. Medicine is very powerful. So less powerful medicine should be given to her. That's it. So medicine is the problem. A delay between the initial infection and treatment. A treatment, who will give treatment? Doctor. So here the doctor is the problem. Okay, the doctor is the problem. Here she is problem. Here medicine is problem. Here doctor is problem. Because of the doctor's delay. Doctors delayed. Okay, doctors did not identify, doctors did not treat the initial infection. Infection was there and it should be diagnosed and it should be treated. That is delayed. So, initial infection and a treatment. There is a lot of delay. So, you can understand the first one is the treatment is the problem because treatment is delayed. So, problem is Jennifer, problem is the medicine, problem is the treatment. Should understand this, how this is a trifurcated. You know the word of bifurcated, but you do not know the word trifurcated, right? That's the point, trifurcated. Okay. So how it is trifurcated, you have to notice. Yeah. So think about these things. What problem? She was the problem. Means Jennifer was the problem. Medicine was the problem. Treatment was the problem. Medicine is powerful. She is adamant. Medicine is powerful. Treatment is delayed. Try to understand. She is not willing. She is adamant. She is reluctant. Medicine, not okay. It's very powerful. She cannot tolerate it. Intolerable. Treatment. Yeah, treatment is delayed. Why not early treatment? So think in a different angle. Successful people, okay, don't do different things. They do things differently. Okay. So analysis. This is the analysis. So now that's very clear. Now let us see here. We're going to the script now. I'm making listening into reading for you so that you will understand what you should expect here. Yeah. What you should expect here. Yes, next one. Jennifer. Jennifer is here. So here is Jennifer. Well, another patient, treating Chagas. So you understand here itself is question there. And what issues can arise in treating Chagas? Okay. What issues can arise in treating Chagas? See here, what issues? Issue is already here. Arise in treating Chagas. Here itself there is some clue. Okay. Here itself there is some clue. I'm hiding the distractions. Yeah. So there you are. Okay. What issues? See here, question is asking what issues can arise in treating Chagas? Why are we making nonsense out of common sense? See the question here itself. Does it give a clue? He's telling what issues can arise in treating Chagas. So that's the clue there. That's the clue there. 1 minute. 1 minute. Check everything is fine in the lecture. Check everything is clear. Okay. Yeah. The point here is you should know the clue is here very clearly, glaring and extremely clear. So here it is. What issues can arise in treating Chagas? Treatment. Okay. In treating Chagas, treatment. You should be aware of what he's telling here. Okay. Well, now here you can see. Yeah. Right. Now here, she was also fearful about taking benzimidazole, the main drug used for Chagas. She was also fearful. She is afraid of taking the main drug because it has potentially harmful side effects. For optimum impact, it should be taken in the first 2 months of the disease, but it was not taken. It was not taken. But by the time the testing had been completed, 10 weeks had passed. 10 weeks. Where are 2 weeks? And where are 2 months? 2 months means 4 weeks. 2 months means 4 weeks. Plus 4 weeks, 8 weeks. 2 months means 4 weeks plus 4 weeks, 8 weeks. And by the time the testing had been completed, testing was done in the 10th week, maybe 11th week. 10 weeks had already passed. Since the likely date of the bite had passed, since the likely date of the bite. So you can understand here 8 weeks and 10 weeks. The time is elapsed. It is delayed. Treatment is delayed. And didn't Jennifer took benzimidazole and didn't react badly to it. She was afraid, but she did not take the medicine. So testing had been completed only after 10 weeks. Okay. Try to understand here. Okay. So treatment. Testing is over, but taking treatment, that is taking benzimidazole. Okay. That medicine. What is that medicine? Taking benzimidazole. Benzimidazole is treatment. And from testing to treatment, okay, treatment should be within 2 months. That means 8 weeks. But now it crossed that required effective period and it is reached 10 weeks. So there is a delay, too much delay. The sooner the better. But 10 weeks passed. So there's a lot of delay. Okay? There's a lot of delay. That's what he's telling here. Now let us check the answer. Okay. So you have to see very clearly how the text is progressing. How the text is progressing, you have to notice that. Yeah, the synonyms play a pivotal role in reading and listening. Everywhere this is very, very important. Now let us check the answer to this. Yeah, 32, 33 is A. 32, 33 is A. And now which question are we doing now? It is 34. Yeah, 34 is a C. And what is C? A delay between initial infection and treatment. Okay. A delay between the initial infection and treatment. In the question only there is answer, na? In the beginning itself he told. What problem? Problem means issue. Does Dr. Robson identify in the case of a patient called Jennifer? What is the question she asked? Okay. What is the question she asked? Let us go there. The question she asked is here. Okay. What issues can arise in treating Chagas? Treating. So treating is there where a delay between initial infection and treatment. Treatment is here. I don't think the first sentence itself gives you answer. First question. The question of the interviewer itself gives the answer there. Okay. What issues can arise in treating Chagas? The question is based on treating. Okay. Be careful there. You got the clue there itself. Okay. For optimum impact, maximum benefit, it should be taken in the first 2 months of the disease. That means the more the delay, the less the impact, the sooner, the more the impact. The optimum impact, the sooner, the better. That's it. That is the point. Okay. That is the point. Right. Yeah. So that is fourth one. So we have done 4 questions so far. Okay. So, shall we continue with 2 more questions? Shall we continue with 2 more questions? Then we'll take another passage. A new one. Yeah, anyone can send. Rani, you can send. Or Dr. Swati, you can send. One more passage you send, then I take that one, whichever you are facing difficulty. Now let us take yeah, 5th question. Yes. 5th question. 35. You won. You won. Yes. Yeah. That is the 5th question. Go through this question, please. Okay. Yes. What does Dr. Robson say about his patient called you? Mute your phone, please. Mute your phone, please. With that.
செக்க சாப்பிட்டியா செக்க நல்லா 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 இருந்தது செக்க
Vijay,
சரி
why is your phone on? Yeah. Okay. So this is also, oh, this is question number 3, right? Yeah. This is also analysis same like previous. Think about the one word which will, okay. Think about one word in all the 3 sessions. Think about the one word in each one. Yeah. Identify those words. Yeah. Yes. Now, what does Dr. Robson say about his patient called Yuan? What does Dr. Robson say about his, what about Yuan? What about Yuan? What does the doctor say? Says about what? The development of his illness was typical of the people with Chagas. Okay. The development of his illness. So the problem is with illness. The development of his illness was typical of people with Chagas. Next one, an incorrect initial diagnosis. So an incorrect initial diagnosis resulted in his condition worsening. So diagnosis is problem, illness is problem here, diagnosis is problem. The medication he took was largely effective. Medication is the problem. So illness was the problem. Diagnosis was the problem, wrong diagnosis. And next one, medication is the problem because the ineffective medication. Okay. So illness was typical. Illness was typical. Diagnosis was incorrect. And medication was ineffective. See here. So the problem is with illness, the problem is diagnosis, the problem is medication. So which among these is the right answer? You have to think very carefully. Then only you can give the right answer. So you should identify which word you should focus. You cannot focus on each and everything, right? So you should focus on the main word, how it is differentiated, why it is okay, getting a trident shape, 3 different angles. The first angle is the problem with illness because it is typical with Chagas, so they did not understand. Okay. Second one is the diagnosis is wrong. That's why condition worsened. Earlier only it was diagnosed properly, then he would not have worsened his condition. The medication is ineffective. So he should have taken effective medication. So medication is the problem, diagnosis is the problem, illness is the problem. Illness was common, it was not special, it was not different. So they thought normal. So no need of anything. Okay. Yeah. So you should try to understand how the patterns are moving into three different angles. Once you are done with that, then you are fine. Now let us go to yeah. One is here. So let us focus on this area only. Right. Now, if you see clearly, and do you deal with patients in later stages of illness? Later stages of illness, try to understand that point there. And do you deal with patients in later stages of illness? Means worsening condition. That's very clear. Later stages means worsening condition. That's understood. Worsened, condition worsened. Why? Why? Why condition worsened? What's the reason? There itself you'll get the answer. You are medical professionals. You already the knowledge of that one. It's not like other people. Even a person with good English knowledge can understand. You are medical professionals. You cannot miss these things. And do you deal with patients in later chronic illness? That means worsening condition. Yes, I have a 62-year-old patient called Yuan. 8 years ago, he was diagnosed. 8 years ago, he was diagnosed with dilated cardiomyopathy, and Chagas was also detected in him. If he had been tested for Chagas earlier in life, 8 years ago, he was diagnosed with two things, dilated cardiomyopathy and also Chagas. If he had been tested for Chagas earlier in his life, that means late detection. 8 years ago only it was detected. If it had been detected 18 years ago or 28 years ago, his long-term prospects would have been better. A year after the diagnosis, Juan was found to have type 2 diabetes. This was dealt with relatively well. Though his body did initially reject insulin, Juan took drugs for his heart and for several years was reasonably stable. But eventually monitoring revealed severe cardiac deterioration. His experience is very much what you would expect in someone who has had the disease for years and it reached the latter stages. There's no cure. And the main recommendations are rest, exercise, and appropriate diet. Why? It reached the latter stages. Now there is no cure. Now there is no cure. If it had been earlier stages, cure was there. And the main recommendations would have been, in addition to rest, experience, and appropriate diet, are the only now in the latter stages. In the earlier stages, it would have been different. It would have been different. So what happened here? What happened here? He was diagnosed 8 years ago. Okay. If he had tested Chagas earlier in life, his long-term prospects would have been better. Now they are worse. Why was he not detected earlier in life? Why was Chagas not detected earlier in life? Why he had not been tested earlier? What is the government doing? Okay. Why was he not tested earlier? The authorities should have tested him. Na? Why? 8 years only he was detected with Chagas, along with the dilated cardiomyopathy. Otherwise, if he had not diagnosed dilated cardiomyopathy, he would not have gone to doctor. He would not have got Chagas also detected. It would have taken some more time. Okay. Why 8 years only he was diagnosed? Why not earlier? If he had been tested for Chagas earlier in his life, his long-term prospects would have been better. Okay. So try to understand this. Now there is no cure for him. If he had been diagnosed earlier, there would have been some cure. Now nothing to do, only rest, exercise and diet, nothing else. Okay. So try to understand this very clearly. So what is the problem here, do you think, is very important? Why 8 years ago only? Why not earlier in his life? Diagnosis. Okay. If it is diagnosed earlier, there will not be later stages, right? You can cure it. It will not turn into chronic stage. Initial stages only they would have detected. He would have recovered. Okay. So try to understand that one. It was not detected. He was not tested. So they did not diagnose this problem. Okay. So, right. So be very careful with this. Now let us check the answer. Yeah. 34A. See what exactly is telling there. Okay. What did Dr. Robson say about his patient called Juan? Okay. What does Dr. Robson say about his patient called Juan? Try to understand the question there. Okay. 35. It's delayed diagnosis, but not wrong diagnosis, right? It's not a wrong diagnosis, it is delayed diagnosis. They diagnosed late. Where is incorrect initial diagnosis? Okay. Now let us see here very carefully in the question part. Okay. So incorrect diagnosis. Diagnosis is the problem. Delayed diagnosis. Why they could not diagnose? Now let us go to the text here. Yeah. Yeah. Yes, I have a 62-year-old patient called Yuan. 8 years ago, he was diagnosed with a plated cardiomyopathy, and Chagas was also detected in him. If he had been tested for Chagas earlier in his life, his long life prospects would have been better. Try to understand this very clearly. Okay. This is question number 35. Yuan. What does Dr. Robson say about his patient called Yuan? Okay. So, he was not tested. Why was he not tested? Why was he not tested? Why was he? Why? Okay. Now here, a year after the diagnosis, Yuan was found to have type 2 diabetes. This was dealt with relatively well. So here, he was diagnosed only 8 years ago. Before, they took it as normal. Diagnosis was correct only. There is no wrong detection. Okay. It's not incorrect diagnosis. Okay. So 35. The development of his illness was typical of people with Chagas. So that is why they did not even test him. They did not even test him. He was not tested. He thought that it is Chagas. That's it. Okay, normal sickness by the people with Chagas. The development of his illness was typical of people with Chagas. All the people who had Chagas, he had the same thing. Okay, right. It's not an incorrect initial diagnosis. It was correct only. It was diagnosed with the dilated cardiopathy and Chagas. It's nothing, nowhere written as incorrect diagnosis. Okay. They treated him like the people who has Chagas, they treated him like that. That they did not bother about him. They did not take it seriously. They should have tested earlier and confirmed. Okay. Right. Last question. Yeah. Sixth question. Yeah. The sixth question for today. Question 36. Dr. Robson thinks the short-term priority in the fight against Chagas is short-term priority. What is the short-term priority? Short-term priority. Increase efforts to eliminate the insects which carry the parasites. Insects. Produce medication in a form that is suitable for children. Design and manufacture a viable vaccine. So insects, children, vaccine. Insects, children, vaccine. That's it. What is the long-term priority, short-term priority? He's asking, what is the short-term priority? Short-term priority. Eliminate the insects. Insects are the problem. So eliminate. Produce medication in a form that is suitable for children. Children have problems. So create medication. Invent some medication. Then vaccine. Vaccine is not there. So design and manufacture. So insect is a problem. Children have a problem. Vaccine is a problem. No vaccine is a problem. So design vaccine. That's how you have to take it. Yeah. Go through this now. So eliminate insects. Medication for children. Create some vaccine. Yeah. So now coming to the point, let us go. So insect, eliminate. Then children, medication. Okay. And vaccine, so design. Yeah. Now you can see here. I see. And what can be done? Action plan. What can be done to combat Chagas generally? What can be done? Action plan. So short term, long term, right? Now let us see here. Okay. Researchers are working on improved drugs to treat it and a vaccine. None currently exists. So there is no vaccine. There is no vaccine. But it takes at least 10 years to supply a new drug. 10 years. So it is long term. Vaccine is a long term. It takes 10 years to supply a new drug. 10 years. 10 years. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. That should be done almost overnight. That means short term. What currently available is designed for adults. Even though infants often have the disease, but they don't have drugs. So infants have the disease. The drugs currently available is designed for adults. Designed for adults. Infants also have the disease. So overnight, almost overnight, means this is short term. This is at least 10 years, means long term. We don't want long term, we want short term. Okay. There are also some very important programs using insecticides and other methods to wipe out the bugs that transfer Chagas to humans. But initiatives like those take decades, tens of years. So this is also long term. So this is long term, 10 years. This is decades, 20, 30, 40 years. And this is almost overnight. Now you consider, what do you think is the answer? Maybe right, maybe wrong, but you can give your answer. So you should understand, short term means overnight. 10 years. And these are decades. So now try to understand here how you can eliminate these things. So 10 years, decades, rather than years. Decades. And this is almost overnight. It can be done, even though, okay, even though infants often have the disease. What's currently is designed for adults. Okay. Another idea is to drugs in tablets of different sizes that could and should be done almost overnight. What's currently available is designed for adults. And even though infants often have the disease, they don't have the drugs for infants. So what can be done overnight? So now you can give the options there. Now let us check the answer. Yeah. So short term, which is short term, 10 years or overnight or decades. Overnight drugs can be done, and drugs are already there for adults, but drugs are not there for children, but children already have the disease. You think about these things. Maybe right, maybe wrong, but analyze the question so that if it is right or wrong, we can. And now let's move on to the text and check our answer. "35 is A and 36 is B. 36 is B. And what is B? Produce medication in the form that is suitable for children. Short term. Overnight they can be produced. So produce na. Why are you silent? Okay. So I made your listening into reading so that you will understand. Yeah. So you can give your feedback. How was the session? How beneficial was the session? In your own words, 2 or 3 sentences. Your Dr. Rani was requesting me for this session and everyone were asking. So she came first, so I asked her reading or listening, and she said listening. And part ABC, she said C. So I gave C now. And in the afternoon, we'll do part C reading a little bit later. Okay. So just to share your experience there in 1 or 2 sentences. I'll give you the chance to speak now. I'm giving 11 participants to speak. Yeah. Dr. Rani, you can share your experience. You have already done, but we did not do listening test now. We have done something different. So you can share your experience, how beneficial it was. Yeah. Dr. Arshia. Yeah, Dr. Vanajaran. Yeah, share your experience.
Sir, it's very good, sir. It's really improved. And how to know the synonymous words and vocabulary to find out the exact words.
More than all these things, what you should expect from the questions and audio. What you should expect, that is already there in the question. So from there, you have to expect
The
something, and what
keywords.
are the words that you have to catch?
The keyword from the question, the audio. So the synonymous words we have to find in the answers.
Yeah.
And also like a cause and effect.
Yeah, let us talk to Dr. Sadaf. Hello, Dr. Sadaf. How was the session for you? If you are comfortable, you can speak a few words. Welcome to our channel. And then Arshia, Dr. Arshia.
Hello, good morning, sir.
Yeah, good morning, Arshia.
How are you? We are waiting this long for this session, and it is very nice to hear you all this. So it's very beneficial. Really, we want daily. So it is like we feel motivated after listening this whole lecture. We feel like okay, yeah, it's fresh knowledge is there in my brain. Otherwise, I was feeling very depressed. It's long we didn't do anything.
Yeah, here is our channel. So this is going on live now. Okay, there you can go and check in live sessions here. Okay,
Yes,
you can just check reading lecture. All the reading lectures you will get here. Okay, all the reading lectures you will get everything. No need to wait. There are a lot of hundreds of videos here reading. At least 100 reading lectures will be there. See here. Listening lecture. Okay. Right, lecture. So all these lectures are already there. You see, skin cancer lecture. Okay, tips for exam going students, reading session, evening batch. Everything is there. Benjamin Duret lecture, migraine, part C, listening. Okay, tetanus, feeding tubes, perception. And here, official authentic medical, listening lecture, morning. And this is techniques, Helen Sands. Okay, see how everything is there. You can go through them. Okay, so here, see the arrow marks and everything. The mostly attended will come here. So see how many people might have, how many Hundreds of people might have watched this one. That's why this picture is coming there. Okay, people are viewing that one more. This arrow marks. Okay, that is what is helping. So industry funded nutrition research. See, everywhere arrow marks only was coming there. Okay, see here, aspirin resistance, tetanus. Okay, this is reading part C. Sleep deprivation. This is Aidan Fitzpatrick. This is reading session evening, listening lecture. If you want part A, write down part A, reading part A, reading part A. Only reading part A will come. See, part A, part A, part A, all. Obesity, pneumonia, okay, cytokines, tetanus. See here, assessing pain. OET reading part A, assessing pain, tetanus, cytokines, necrotisis, okay, pneumonia, obesity. Okay, you can watch there from there. So no need to wait. You can just go through all these things. Okay, number of lectures are already there. New, I'm
Yes,
giving
sir.
you different styles.
Yes,
Stroke
yes, sir.
patients. Okay, addiction to prescription, iron deficiency anemia, and vitamin C deficiency, skin rash. Okay, all different lectures are there. MRSA. Okay, this is cholesterol free fats. Okay, you can see everywhere. You can see. See, this is the most viewed. All is orange, but this is the most viewed session. Okay. So a lot of lectures are there. See how many lectures, hundreds are there. If you want part B, see this is part A. Okay, part A. And if you want part B, just write part B, and you will get there. See part B, part B gestion, part B. Skin cancer, part B. Kaplan, part B. Okay. So skin cancer, part B questions 1 to 6. Okay. All these things you can go through them. Aspirin resistance, part B. Lot of there.
Yes,
Okay,
sir.
Dr. Arshia, is that clear?
Yes, sir. Yeah, yes, I'm doing it.
Yeah. You can go there and you can search. Hello, Anju.
Thank you. Thank you.
Yes, sir.
Yeah, was it useful for you?
Yes, sir, very much. But, sir, I'm wondering about myself that simultaneously looking for the keywords and listening, how pretty good I will do, sir. That was I'm wondering.
Yeah, struggle, work hard, work hard. Okay, work hard and clear everything. Okay.
Yes, sir.
Okay, that's the end of the session.